asking yourself, what is it that you really need? What is it you really need in this moment?
Mm.
And I'm not talking about, oh, if I just had, $5 million, I could just quit what I'm doing
Yeah.
and go around the world.
Yeah.
Talking about needs in the way of values, because needs and
Mm.
values go hand in hand.
Mm-hmm.
I need affection.
Mm.
I need compassion. I need rest.
Mm-hmm.
I need um, solitude,
Mm-hmm.
or I need activity, or I need whatever it is. And then take care of those core needs that you have. And you're not disturbing anyone. You're giving gifts to all the people who benefit
Mm-hmm.
from you not being selfish, but being self-aware
Mm-hmm.
of your own needs.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. It's been a hot minute. I was telling Joe here that it's been about 7 months since I've uploaded a video on this channel, and I was so grateful for him to be the person that's coming on as we jump back on the ship. And for anyone who does not know him or doesn't know his background, this is Dr. Joe Sherman. He is a board certified pediatrician. He's also a physician coach and a consultant. And he supports physicians to transform their relationship with the unrelenting demands of the jobs and discover a path towards meaning, professional fulfillment, and career longevity. And I love those words that you provided me, Joe, especially the meaning when so many people have lost sense of meaning, not only in medicine, but their lives when they're, who am I outside of medicine? Professional fulfillment, we know burnout loses, people lose a lot of fulfillment, and that career longevity, or people like, how long can I do this? So today we'll really be talking about Joe's experience with his own mental health journey, I'll call it.
Mhm.
And I'm sure many people will be able to relate to that. And also career discernment. We're having a lot of people that are asking the question, should I stay? Should I go not only in their particular position, but as medicine as a whole? So I'm looking forward to jumping into that with you, Joe. And where would you like to start? How about a little bit more about your journey and why these topics are so important to you?
Sure. Well, first of all, let me thank you for inviting me to appear as a guest. I've always has always been an admirer of you since I met you, just for your courageous career moves that you have made, and it makes me not feel so isolated and odd as I have shifted jobs at least every 4 or 5 years in my career. So
Mm-hmm.
thank you for consoling me in that in
Absolutely.
that
And it's mutual.
situation.
It's
Yeah.
mutual. It's funny because you brought me towards the self-compassion along the way and so much of the judgment that comes with career transitions. And to figure out that medicine is one of very few places where the linear job is the norm. And people in other things such as business they're encouraged to shift. So it's fascinating, isn't it, when we find shame and isolation in the, oh my gosh, like, am I the failure for pivoting? And I was telling you before we started that first pivot I made, I isolated in guilt and shame and almost died. And then once I realized like we can actually give ourselves permission to do this all the time, I'm like, embrace. And then we find each other, right?
Yeah. Yeah. It's been fantastic. So like you said, I am a general pediatrician, and I grew up in a family of 7 children, the first generation of my family that went to college. So my parents were both high school graduates, and their main goal in life was to try to give opportunities to their children. And so I appreciate that, and I also recognize that by being the youngest in a large family, there's a lot of not a lot of love to go around to every single person individually. And my parents were amazing people, and but they left me early in college when I was in
Mm-hmm.
college. So I was on my own by the time I got to my senior year of college and had thought about medical school all along, even in high school. But while I was in college, I was studying engineering
Mm-hmm.
and always had this was also passed down from my family, always have a job thought of and how
Mm-hmm.
you're going to support your family and what's going to
Mm-hmm.
be down the line. And so there was this sense of, is this what I really want to be doing? I can remember this in late undergrad, and I'm not going to go through my entire career like this at the beginning, but just
I
to
mean,
give
you
you the
could with
seeds.
me, but I guess the
I know,
guests
but
might.
with the seeds
I love
of
learning
where
about it.
this came from.
Yeah.
And then when I was in college, one thing that really arose during that time, as I look back, retrospectively,
Yeah.
was that I really enjoyed being a resident advisor, a counselor, a
Mm-hmm.
mentor, all
Mm-hmm.
of these qualities and values and gifts that I found within myself and discovered about myself
Mm-hmm.
occurred during this time of college, where it's a great coming out period for many people.
Mm-hmm. Mm-hmm.
Now, what I did was after my parents died, that was kind of all and good, yet was my path, and that's what was laid out in front of me. And so that's the path I took. And medical school was very challenging for me emotionally, psychologically, academically. When for me it was when the mood swings would start to come and the anxiety arose about, is this where I'm supposed to be, is
Mm-hmm.
this where God wants me to be? That
Mm-hmm.
was a lot of my discernment.
Mm-hmm.
And what happened was I would became increasingly anxious and tried to isolate myself. But then I did also have some great friends that helped support me along the way. Found a mentor in pediatrics, and that was an interest of mine to begin with. And this mentor took me out into the community while she was in practice in Richmond, Virginia. And I started to discover community pediatrics, what it meant to
Mm-hmm.
actually go out into the community and be with the families you were caring for. And that's really what brought me to life and
Mm-hmm.
began my career, which really I would say throughout my career, both domestically and abroad, internationally, it's been bringing the combination of training pediatricians,
Mm-hmm.
family medicine doctors, medical students, and in the communities and the community agencies that serve families that they are taking care of. And that took me all over the world and through Washington, D.C., over to Seattle, Washington. So
Mm-hmm.
that's kind of the career as a pediatrician went.
And you said so many wonderful things I'd like to ask a little bit more about
Sure.
because especially when it comes to when people feel pushed into certain career paths and they have that kind of existential angst or anxiety and they're not quite sure why and they tend to quiet down some of that inner voice if the external voice from the family is a lot of pressure. And when it came to kind of understanding within yourself where some of that pressures were coming from and how to tune into your own voice, what did that look like for you?
Wow. So the way it looked in the beginning, early on in my life, were some mentors and I would say friends and unofficial counselors to me who I
Mm-hmm.
reached out for during this time of grief and loss from my parents,
Mm-hmm.
and encouragement to be reflective and to
Mm-hmm.
journal. And I remember beginning journaling my second year of medical school. And I'm not sure every medical school has a different curriculum these days, but back in the previous generation, the previous century,
Mm-hmm.
we did have a
Yeah.
break between first and second year of medical school, and between second and third, there was a little bit, but there was board exams somewhere in there, I think.
Mm-hmm.
But during those breaks, I would like go become a camp counselor or a resident advisor in a college program or something
Mm-hmm.
like that. And
Mm-hmm.
being able to add these experiences outside of medicine
Mm-hmm.
with reflective journaling and talking to people outside of healthcare
Mm-hmm.
about life and what the purpose of life is and what we were meant to be or where we find ourselves and
Mm-hmm.
how to make the best of where we are. And so that's where the seeds of a lot of that reflective practice came.
Mm-hmm. And it really encompasses that we're more than just that one career title. When thinking about that expansion and how oftentimes when it comes to burnout or mental health challenges, not even in medicine, just when I was on my psychiatry rotation, I was often in the crisis unit, and people would come in there after losing a job, especially men, because their sense of worth was so tied to their job. And you had mentioned about really getting in touch with your own personal values. And so similar to the other question is how do we identify when there's the external values that may or may not align with our true values and your true values that kind of became that compass for you?
This can be extremely challenging. And I would say with my individual clients,
Mm-hmm.
this is one of the initial practices that I go through with them because as physicians, we come in to the training environment with a people pleasing attitude
Mm-hmm.
because the reality is that's how you get ahead in
Mm-hmm.
medical training
Mm-hmm.
and in your career is you look at whoever is in charge of you
Mm-hmm.
and you try to emulate and imitate whoever that person is
Mm-hmm.
and they think that you are amazing because you're like
Mm-hmm.
them.
Mm-hmm.
So
Mm-hmm.
that's how you get ahead.
Mm-hmm.
So for me and for my clients, the first thing that I do is I say, I want you to look and close your eyes and think back of any experience that just comes to your mind
Mm-hmm.
where you felt like you were exactly where you were supposed to be. You
Mm-hmm.
had this sense, this
Mm-hmm.
feeling
Mm-hmm.
that almost like time was standing still and
Mm-hmm.
that you could do whatever it was you were doing
Mm-hmm.
forever.
Mm-hmm.
Or after it was over, because things end, that you could not wait to get back to something like whatever you were doing or who you were with or what you were involved in. Inside medicine, outside medicine, it doesn't matter because
Mm-hmm.
values permeate
Mm-hmm.
all your life.
Mm-hmm.
So that's where I take people on that meditative, reflective adventure.
Mm-hmm.
And then tell me the story. Tell me who was involved. Tell me where you were. What were the smells like, the feels like, the sights like, the taste,
Mm-hmm.
everything you can imagine.
Mm-hmm.
And who was around? What were they like? What were you like with them? And then from that story, extract those qualities and gifts that you were encompassing, that
Mm-hmm.
appealed to you, that drew you in.
Mm-hmm.
And those are usually your core values. And then I can give them a list, say, here's some things that people come up with.
Mm-hmm.
And there are extensive lists of core values that you can come up with. And then I try to have them narrow them down. And, sometimes I'll have them rank them and things, but I know that a lot of our physicians and myself are perfectionists and we want to get the right
Mm-hmm.
ranking and everything. I
Mm-hmm.
should like chill out a little bit with that.
Yeah.
That's all right.
Yeah.
They all count.
Well, that's even part of the you said people pleasing is really a defense mechanism. So is perfectionism. So it's in that process of finding yourself, we often realize the perfectionism, it served a purpose. It's just like the people pleasing, and to really get to your core essential self, it's breaking down that wall. And some of the things that you said about feeling state, oftentimes I'm curious to hear what you've experienced with helping people. For the survival in medicine, we often stay here. And to re-get in touch and like, what do I feel? Especially if they're burnout, I'm like, I feel nothing. I feel numb. I feel saturated. I'm so disconnected. And what you said there was, how would you feel? Because oftentimes, if we think about end goals, people can create all these end goals. And if we ask, like, well, how would you feel if you got that end goal? That's kind of the what metric I use to see if that goal aligns with what they truly want or if it's like a superficial societal goal they think they should want. And so the how would you feel? And then with the authenticity being able to unmask, what would people notice about you? How would you be showing up? Because often people, they stand like, this is the authentic, like, I'm authentic, I can expand. And we know it's likely not really you if you're like, oh, I would be shriveled up in the corner and I would be contracted, or like, okay, maybe we haven't yet hit where you are truly going to be able to just be your true authentic self.
I love, I hope people are watching this on YouTube because the way that your body expanded and
Mhm.
opened up versus closed and I think that those are the kind of things that people and I want to talk about my own experience, but I have to be careful about generalizing about all physicians
Uh-huh.
because I think too many of us
Hmm.
do that. But I would say that there is a culture in medicine that has us in medical school contracting and as residents
Hmm.
contracting
Hmm.
because there is fear, there is apprehension.
Hmm.
We are in a chronic stress state because we are hyper vigilant about how we're looking, how
Hmm.
we're comparing to our classmates, how the attendings and residents, what they think of us.
Hmm.
And so having physicians, individuals, and myself, I would say everything that I do with individuals as well as groups, I am like maybe one or two steps ahead of them in the personal growth process.
Hmm.
Sometimes a step behind them, and I learn from them
Hmm. Hmm.
often.
Hmm.
And so this sense of getting in touch with your body, and
Hmm.
I kind of joke around that I always surround myself with several helper people. I have
Uh-huh.
therapists, coaches, spiritual directors, friends,
Hmm.
all these like, let me just process this with you. I'm a verbal processor.
Hmm. Hmm.
And so many of them, especially a spiritual director who I have, who is a former family physician, former minister, former like he's been a lot of different professions. You're familiar with this.
Hmm.
So he's able to bring all of that together. And one of the things he would say to me over and over and over again is like, where do you feel it in your body?
Hmm.
Like, what do you mean? I'm talking about this thought I had about this idea or
Hmm.
what? It's like, yes, but where is it?
Hmm.
And literally, like you say, below the neck, it's kind of, well, I know where my aches and pains are. I know my
Hmm.
back hurts me all the time. I know my abdomen. It's like, ah, okay. Well, tell me
Hmm.
about those places. What? Well, that's this medical diagnosis and this medical
Yeah,
diagnosis. And
right? Yeah.
like, yeah, right. But tell me what you're feeling right now. And I would say it. It's like, okay,
Hmm.
stay with that feeling, stay with it. Because our brains lie to us.
Hmm.
Our thoughts lie to us all the time,
Yeah.
but our bodies don't. I mean,
Hmm.
our bodies tell us things that we have to pay attention to. So,
Hmm.
having clients as well as myself, a daily practice of where I feel things in my body is essential so that we can get down to what's really happening.
Yeah, I think we're doing a huge disservice in medicine, even with what you were saying about how we have to maintain this contracted state. And really, it just is because we're enduring all these different trauma experiences and to protect ourselves and how we become dissociated. And in medicine, what I often hear, what was true for me, is we ignore our basic needs. So we desensitize ourselves from our body. For me, what led me to leave surgery is I actually starved myself near to death. Like my heart rate was in the 20s. I was numb. I don't want to be in my body. I didn't, it was not a safe place. You have supported me in the self-compassion and growth so that I could feel safe within my own mind. And then with being safe within my own mind, I slowly became safer in my own body. And I say that to normalize. I think a lot of people listening will be like, there's no way in heck that I will get into my body right now. And I think what's underappreciated is how much physicians are at risk for developing PTSD and a lot of embodied trauma. And so it makes sense. And doing trauma informed work and supporting people when it comes to processing trauma. I'm curious what comes up for you as I say that in your experiences working with yourself and with others.
Hmm. Um, there's an excellent, well, there are many books about trauma and the body, but one of my favorite is Resmaa Menakem's My Grandmother's Hands.
Mm-hmm.
And in this book, he primarily talks about racialized trauma and how the body holds on to this. But he talks about all people and all trauma and how we have ancestral trauma, intergenerational trauma, experiential trauma, secondary vicarious trauma. And I
Mhm.
don't want to, like, it sounds like I'm throwing the trauma word, the
Yeah.
big T, little
Yeah.
t. But the reality is, all of us
Hmm.
absorb trauma.
Hmm.
And it's almost, and I talk about this a lot with my physician clients, as we are exposed to stressors and trauma, then we need to do something with that.
Hmm.
We ingest it into our bodies through our eyes, our ears, our senses, our touch, everything, our experiences. And if we don't have some method of processing it, metabolizing it,
Hmm.
understanding it with a number of different methods, which is unique to each person. So
Hmm.
I don't tout one over the other, but I have my own personal experience. And for me, I remember that being raised in a very traditional Catholic family,
Hmm.
self-sacrifice and putting others ahead of yourself was your key to heaven.
Hmm.
And for that, I absorbed very ambitiously, enthusiastically, took that into medicine,
Hmm.
into my life. But what that does is all those things that perhaps I desire for my own well being and for my own sense of who I am and what I have to offer other people
Hmm.
becomes lost and
Hmm.
becomes, I know there's a better word for this, but I will say deformed in some way
Hmm. Hmm.
to where it becomes what the other person thinks I should be or what the
Hmm.
other person wants. And so we take that into medicine, and then what do you do with it? And at first, I discovered the practice of mindfulness meditation, which I thought
Hmm.
was wonderful
Hmm.
because it did bring me back to a focus that was out of the spinning thoughts in my head, all of
Hmm.
the anxious thoughts of what ifs and oh no, and didn't that, and whoa, no, what did I do wrong? And are they looking at me? And all of
Hmm.
these things. And instead brought me to some other focus of attention, my breath, my body, whatever. And then during COVID, I heard this psychologist, a developmental psychologist, Kristen Neff, on a podcast talking about this thing called mindful self compassion.
Hmm.
And I was like, okay, compassion's one of my big values. So that's
Huh?
got me perked up.
Hmm.
And so I listened and and instead of doing this kind of, I'll call it like woo woo stuff about what you should, she just started to recite the literature and the research. And
Hmm.
it's like, wow, this is a scientist. What's going on here?
Uh-huh.
And this idea that you can actually be that loving, soothing person for yourself during your
Hmm.
mindful moments.
Hmm.
And you need the mindfulness to be aware of what's happening, aware that you are suffering in some way,
Hmm.
but that you can actually place a hand on your body and
Hmm.
have physiologic responses, and that you can say soothing things that you wanted to hear
Hmm.
from those who loved you. And they tried so hard to love you in the way you wanted and needed to be loved. And they were doing the very best they could with what they had, as you are now in this moment.
Hmm. Hmm.
And so when you can incorporate that into loving phrases and breath and body sensations, it can be powerful. And it's not like this boom, overnight experience, but it is bit by bit, drop by drop. And I can tell you that I can't live without it every day of my life right now.
Hmm. And to even think about how big of a paradigm shift it is. So there are many people who will listen, especially from medicine, who are like, there's no way I'm going to switch gears to that because we are well trained to think that in order to be mentally tough, we need to be self-critical. Can you share a little bit more about what made that really stand out for you, because I could just tell in the way you're describing it. It's just like this is profound. This and the fact the Kristen Neff's use of evidence is like, oh, that caters to the physician brain. Because had she just said it without feedback, we might just say, oh, that's woo-woo, won't try it. I've heard that so many times. So may you support us in understanding how hearing that information, what was it shifting you from towards, and how it's impacted you to continue that practice today?
I will tell you the only way that I can explain it to people is for them to do it. And
Mm-hmm.
I didn't understand it until I did it. And when she said, you can place a hand over your heart on your chest and take a deep breath. And as you do that, feel the warmth of your hand on your chest and feel the pressure of that hand holding you and giving you the support of exactly what you need in this moment. And hear the words in your ear whispered of exactly what you want to hear and need to hear right now in this moment. And whatever that might be, whether it means, Jillian, you're doing exactly what you were meant to do. You're doing the absolute best that you can. You are loved, and you can receive that love openly and generously. And you can take it one bit at a time and breathe it in, one step at a time. And by doing that exercise and to actually feel it, and then to have her explain. Now, as you did that, you had stimulation of the vagus nerve, which runs right
Mm-hmm.
between, and then you have
Mm-hmm.
release of oxytocin from the stimulation of your near your breast. It's like, what?
Mm-hmm.
And so then it just appeals to all the scientific,
Mm-hmm.
evidence and everything that she has found. And then you start to feel it and you think, oh, wow, that is happening in there. And I do believe that any mindfulness practice of any
Mm-hmm.
nature, I feel we as physicians have an advantage of knowing everything inside there. We know we actually have been in there and have seen it with our own eyes, whether that's, during anatomy lab or in an OR. So I believe that we as physicians, this appeals very dramatically to people in healthcare. I keep saying physicians, but I think anyone in healthcare,
Mm-hmm.
because it is a small thing that you can do to take care of your own body
Mm-hmm.
and your own heart and soul that is not just about your brain. It's
Mm-hmm.
all about accepting yourself just as you are,
Mm-hmm.
just exactly as you are in this moment,
Mm-hmm.
and asking yourself, what is it that you really need? What is it you really need in this moment?
Mm-hmm.
And I'm not talking about, oh, if I just had, $5 million, I could just quit what I'm doing
Yeah.
and go around the world.
Yeah.
Talking about needs in the way of values, because needs and
Mm-hmm.
values go hand in hand.
Mm-hmm.
I need affection. I need compassion. I need rest.
Mm-hmm.
I need um, solitude,
Mm-hmm.
or I need activity, or I need whatever it is. And then take care of those core needs that you have. And you're not disturbing anyone. You're giving gifts to all the people who benefit
Mm-hmm.
from you not being selfish, but being self-aware
Mm-hmm.
of your own needs.
Mm-hmm.
And I can say for myself, I know those moments that I would go into a clinic and I would be drained because I had not metabolized all of the trauma, all of the stressors and the stress, internal stress that had been there from before. And I knew this one particular job that I had, which really was kind of my last straw of burnout. And I knew it. I was working in a very busy inner city county hospital in the pediatric clinic. And it was on the ground floor of this hospital. And I would park my car in a nearby neighborhood, and I had a pretty long walk because I didn't want to pay for the expensive parking under the
Oh,
hospital
it
parking
makes
lot.
sense. Yeah.
And as I took that walk, and
Mm-hmm.
then I walked through the ground floor
Mm-hmm.
and I passed all the corridors, and I would look at the maintenance workers and I would look at the housekeepers And I looked at everyone else that was working in that hospital and I thought, oh, how I wish I had that job.
Hmm.
How I wish I could just come and do whatever they did and then go home
Yeah.
and not worry and think about all the things that are wrong I'm leaving behind and everything else. And I'm not diminishing who they are or what they
Hmm.
do because I believe everyone contributes to the health and well-being of patients in a hospital. But I would also say that it told me more about what I was experiencing as a
Hmm.
medical director in that clinic and
Hmm.
what I was going through by coming in first thing in the morning feeling that way and then
Hmm.
having to face all of the stressors that I had ahead of me.
That constant mental load. I think what it shows to me and what I hear a lot of people in the jobs that come to mind are the jobs that require less mental load, so much of the brain, and especially if we have not only the mental load that's required, and then like our own self-criticism on top of it, if we're missing something, it just becomes this constant bombardment. And we are saying about some of the Catholic values that came out, that self-sacrifice, that can serve you in some ways and then become detrimental in some ways. I hear a lot of people that, I mean, I joined the military. I grew up Christian. Part of it is like you just give and give and give, and to give yourself compassion, to do these mindfulness practices, to take care of yourself. Often I hear from myself and from people that I have these conversations with, mostly physicians who are burnout, is like it's this challenge of this narrative that they have in their brain. And when you put it to practice, when you started doing the mindfulness and the self-compassion, some people are going to fear, oh, I'm self-centered, I can't give as much to others. What was the reality for you? This is like a very leading bias, but I anticipate what the response might be based off of kind of some of the literature and experiences that I've witnessed. So the question is, as you were more filling your cup, doing this mindfulness, self-compassion, how, what did you realize? What did you observe about your capacity to show up for others?
Yes, I would say number one, less distraction while I was in an exam room or when I was in the presence of families and patients. I wasn't thinking about all the other responsibilities I had, how I was going to finish my charts, who else was waiting in the waiting room, what residents were waiting for me to precept them, what problems were the MAs having with the policies and procedures of the clinic. Instead, I would take a deep breath and put my hand on my chest, and that would just remind me to come to the present, that this mom who just had a newborn baby
Mm-hmm.
and is feeling like she cannot do anything right needs me to be present to her and listen to her and not criticize her
Mm-hmm.
and not say things that are going to make her feel any worse than she's already feeling.
Mm-hmm.
And then I can lean in and truly listen and put aside the electronic record and put aside the computer and be present to that mom in that moment. And I can tell you that if I can do that, that is noticeable. That is palpable by whoever is in front of me.
Mm-hmm.
And they notice. And whether I spend an hour with them or
Mm-hmm.
15 minutes with them, if I spend that time actually listening and attuning to where they are and asking the right questions and truly listening to the answers and have a response that's based on those answers and not based on my own pre-recorded message that's been recorded and stated over and over again.
Mm-hmm.
That person feels seen, heard, felt, and that's going to be an encounter that will increase your ratings and give you better press Ganey scores or whatever it might be. People want to be listened to. And unless
Mm-hmm.
you're listening to yourself and understand what's happening in yourself and doing something about it, you will not be present for that other person.
Mm-hmm. Mm-hmm. Yeah, it's so fascinating when we prioritize the knowledge, right? Oh, well, I'm a great doctor because I have all the knowledge. Well, if your bedside manner is really, really poor, oftentimes the healing comes from that attunement. And what you said there too was non-critical. So that person, I think our culture in medicine, the way we're trained, the way that often we're taught to speak to patients about things to change, it's often very shame-based, very critical. And that does not lead to change. That often leads to the opposite effect of, I'm going to, if I think about weight when it comes to what we shame people for. And rather than get to know somebody, their relationship with their mind, their relationship with movement, their relationship with food, if they're having any food scarcity, it's just like shaming, pointing, criticism, and then people avoid, or if it's an emotional thing that people are either. I think I'm using this example because my long history of an eating disorder. For me, what that would lead me to do, like you can't shame me into healing. It would just make all of my symptoms exacerbated. And when I think about judgment for self and from other people, was listening to, I think it was the Ram Dass documentary, Becoming Nobody, where it helped me to understand that if people are really critical towards us, it really demonstrates their own inner critic. How loud is that inner critic? So once you were able to shift your own self-criticism into a more self-compassionate voice, what did you notice about how you viewed other people?
Now, just as soon as you said that, the first thing that popped into my mind was I am not at this spot where I'm not self-critical and I'm not self-judgmental and I'm not, because that still exists inside of me. There will always be this part of me that started as this little
Mhm,
4 or 5 year old that was watching all of his older brothers and sisters and parents and teachers
mhm,
and trying to be the good kid and the good boy and the teacher's pet. So that part of me is always there. I have to be
mhm.
aware of him.
Yeah.
So he's not gone. And yet I understand now what he needed and
Mhm,
what he truly wanted, which was to be seen for who he was.
mhm,
And regardless of what he achieved or did in his life, he just wanted to be held and loved and understood and listened to. And if I can understand that and give myself a little bit more of that time and time again, then as I do that, I can start to be present to other people and I can see where they are doing the same thing that has been perpetuated on me all of my life. And I embraced fully,
mhm,
you know, if I had other experiences as a child and all along,
mhm,
perhaps I could have had the inner fortitude to understand that that was a bit imbalanced. But I now have this other alternative, this other part of me that has experienced something different
mhm,
and that can bring authenticity and self in a healthier way to my life. And this is after feeling and being paralyzed in anxiety for a time where I couldn't work anymore. And my wife was in tears from saying, you know, you're not present to me, you're
mhm,
not present to your young children. And you may be the hero of all your patients and all the
mhm,
people who work with you, but that doesn't help those who you love the most. And I think for me, what happened in those moments for a lot of times was like this other part of me that was kind of proud and like, why can't you be like me? Why aren't you out there, saving the world and putting everyone else first as you put your own family second?
mhm,
And I think I know I was guilty of that, and many physicians
mhm,
that I work with and that I was exposed to as my role models, both positive and negative.
mhm,
They had families that came second,
mhm.
third, fourth,
Yeah.
and that doesn't help you in the long run. That medicine, I do believe, is a vocation. It is a privilege. It is an honor to be able to do it, and
Mhm,
it's a job. It
mhm,
is one part of who you are. Is an important part, no doubt. And yet, unless we can make that connection to how what we experience in medicine permeates the rest of our lives and experiences, then we will be stuck with that identity of the white coat until we have to and are forced to take it off, and then we're lost.
Yep. Yeah. And what I heard there is that playfulness. So we didn't transcend. So after we developed the self-compassion, all of a sudden we didn't transcend and all the self-criticism is away. And it gave you the ability to kind of step back and to be there with that really self-critical part of yourself to observe how it might have served you and what you truly needed. And then you had the tools to actually be able to give it what you truly needed. And so much of what you just said there, it's, I'm back in grad school, the things, or when people leave employed medicine and then they think, oh, everything's going to be better as an entrepreneur because I have more agency. And then you just keep the same patterns that you had. When I was leaving surgery, I talked to a mentor who the Air Force oral surgery program was known as the divorce residency. It's really hard to put your life first. And the mentor said, I'm addicted to climbing the ladder, not only in academia, but in the military. That for me is something. So I still struggle. It's the holiday season right now. I'm back in grad school, the attachment to grades, the attachment to feedback, like, oh, and I can be there with self-compassion, like, oh gosh, I wish this would just all go away. And even trying to take off. So I have family member who's visiting after the week after next, and I just observed within myself sweaty palms, a lot of anxiety about telling my patients I will not be there and like not the ooh what can come afterwards of the well I guess I could no okay, our clinic is physically closed starting tomorrow until Friday. They had to, if it was not, I would be there. Sometimes it's just they set external boundaries and I sit with the discomfort. So I wanted to normalize in addition to what you did is like, oh, just the awareness alone doesn't absolve all the past behavioral things and the associations we have. And it's like, oh, well, I can observe myself and notice, and I know where this comes from, and what do I want to do about it, and be intentional. And oh my gosh, when we set boundaries as people pleasers, that feeling inside that makes it feel wrong, and shifting into that, when we're having people tune into their body and they feel that guilt when they start setting boundaries, how do you support people in like understanding that our physical cues, that doesn't necessarily mean we're out of alignment with our integrity and authenticity. However, it might mean that we're shifting out of the attachment that we had to pleasing everybody first.
Yeah. And I can tell you from my own personal experience that the lack of setting boundaries merely prevents you from bringing forth your authentic self to those who you love and care about.
Mm,
Because if I have no boundaries and if I say I'll always be there and here's my cell phone and if there's any problems, you just let me know and all of these things, then what's happening is that I am sacrificing my own needs, my own methods of taking care of myself, and my own ability to be whole in order to bring this broken, self-sacrificing shell of a person to someone who I want to care about. But what ends up happening is slowly you start to feel the resentment, you start to feel the judgment, you start to feel all of these other things. And now you are
mm,
not presenting your whole self, your best self to this person.
mhm,
Whereas if you set those boundaries and say, I'm going home now so that I can come back a
mhm,
better person tomorrow,
mhm,
so
mhm,
that I'm not here for hours after clinic filling out charts and trying to take them home after I put the kids to bed and fill out more charts and do all of this work and then come back with this, oh, I'm just
mhm,
have all of this stuff inside my body and now, you know, and I'll talk to my physician clients and I think back to myself and say, oh, but my patients never knew that I was struggling with that. They never knew this. And to a certain point, that was true. But when you start to get comments from patients, from coworkers that are saying things like, "Are you okay?" or
Mhm.
do you have to get anywhere? Or do I have time to talk to you?
Mhm.
You start to get these types of feelings and it's like, oh, what am I saying? How am I
Mhm. Mhm.
conveying this?
Oh
So I
yeah.
do think these setting boundaries is actually a gift that you give to another person to say that I am going to be there for you. And as you were telling your stories about all these different things, I can remember when other people set boundaries
Mhm.
to me and they say, "Oh, no, I can't be there or I can't do that." There's this part of me that has this righteous indignation like, how dare you do that? Why can't you be there for me when I want to be there for you all the time? And then there's another part that's jealous of
Uh-huh.
that.
Yep.
What? How come they can
Yeah.
do this and not
Totally.
suffer inside?
Yeah.
So, just being aware of all of these normal human emotions that
Mhm.
were acquired innocently, and then that's okay. And I kind of chuckle about it when I hear about it because I know the alternative now, and
Mhm.
I can help my physician clients say that, you know, I can tell them that I have left, I think I counted it up, 7 different clinical jobs in my life. And every single time, except maybe near the end a little bit, I always felt like, oh my God, what are these people going to do without me? And they say,
Mhm.
oh my God, what are we going to do without you, Joe? I don't
Uh-huh.
know.
Uh-huh.
And then I contact them a year later and they say, oh my gosh, now we have Dr. So-and-so
Uh-huh.
and they're doing such a great job. Well, it's this. Oh, but we miss you terribly and
Uh-huh.
all of that. But it's like, okay, no one is irreplaceable.
So much,
So,
yeah, so
yeah.
much wisdom was just shared there. So much that resentment that comes from not setting the boundaries and what can we learn from envy when it comes up. I highly respect when people tell me no. I actually realize that they're being honest. Like I trust what they say because I trust that they'll tell me if they can't. Because I realize as like people pleasers, we tend to give people, oh, I know if you can't do it, let me know. It's like an invitation because I know you may not say it. Here's an invitation. Here's an out for you because I know I struggle with outs. And if we just tune in with curiosity, you can tell who's gotten used to it and what we can learn from that tuning in to like, oh, well, I'm feeling resentment that can show us where our boundaries were crossed. We're feeling envy that can show us or jealousy where what we're craving. And if we look at it with curiosity, we're like, all right, what do I need to change? I notice for me how I show up inauthentically that I'm like, oh yeah, this is the consequence of not setting boundaries or being too critical as I start to get like a little passive aggressive, really irritable, not present, like super, super fight or flight. I'm like, okay, not how I want to show up. Not how I want to show up. When I show up that way, I regret it. And I'm just like, oh, and I can have compassion for that part of myself. And when it comes to the thinking that, when we leave, it's so hard for people to leave. It's so hard for people to leave what people say. They're afraid of what people are going to think. They're afraid to abandon their patients. They're afraid that everything's going to explode when they leave. So I think it'd be a great opportunity to discuss a little bit more. What you just shared was like, okay, when we are feeling that way, how do we still lean into what do I need in this moment? And how do I take that next step, even with those fears that they won't be able to survive without us?
I thank you for that question. I personally, I was fortunate enough to have some life changes that brought me away from a current job to another place. And some of those had to do with this amazing person that I married who is adventurous,
Hmm.
not quite as hesitant and self-doubting and second guessing as I am. and had opportunities to live and work in places like Uganda and Bolivia and Kenya and in Dominican Republic and Central America, all these amazing places. And when we made these decisions together, usually with her getting the idea that this would be a cool thing for our family to do,
Mhm.
and then me kind of like struggling with it, and
Yeah.
then finally embracing it, then all of a sudden I had to go back to the people who I felt were so indebted to me and who I gave my life to and say, I'm so sorry, but I have to go. I am being called to go somewhere else to be doing something else. And in, most of the time it was, oh my gosh, this is terrible. You've been so wonderful. Everything is
Mm,
great. And at the same time, there would be the people that said, I'm so happy for you. I'm
mm,
so glad that you have this opportunity because I want the best for you.
mhm.
Those were the people who I who I realized really knew who I was and
Mm,
knew that
mm,
that was the best move for me.
mm, mm,
And I think that when we realize that, when we see that we if we follow our heart and we don't get constrained by these obligations we feel internally and understand and recognize
mhm,
that this is just something holding us back and this idea that what will my patients do, that I'll be letting my patients down. I can tell you as a patient, if my medical provider were to come into me into an office and say, I'm fully present with you now, but it's really hard for me. And I have this amazing chance to go and do something different. I would be thrilled. I would
mm,
say, now this is someone who is genuine. This is someone who truly has been present with me. They're
mhm.
not abandoning me, they're following their heart. And
Yeah.
I think that's what I would want for everyone.
Mm. That was so beautiful. Hearing that I want what's best for you, it's reciprocal. It's I wanted what's best for you, I want what's best for you. And that permission. So when I was leaving oral surgery, I say what saved my life was that my program director saw me as a human first. I was so committed to staying, even if I died. And he saw me. He said, hey, when you come back from your medical rotations, your psychiatry rotations, you are full of joy. You are full of energy. Like I was completely different when you came back from general surgery. You were, right? It's like he saw within me. And when I was with patients, the things that I valued the most to hear their stories when they're asleep, I'm like, like whatever, I can't hear who they are. So what I heard you say is those valuable mentors, those comments in our lives, the people who truly want what's best for you. And I think that next step is being able to give yourself that permission to do what is best for you.
Yes. I'd say one other thing that, again, I was fortunate enough to do was to always look around for someone who was kind of coming up behind me in some way, either as a resident, a fellow, or another attending physician, because most of my career was connected with academic medicine in some way, just from
Mhm.
a teaching perspective, not a research perspective. But if I could do that, if I could identify the qualities, the human qualities of leadership, which I believe are presence, compassion, mindfulness, awareness, and those qualities in someone, along with the ability and knowledge, which I think is there for most people that make it to that point, that I would encourage them to kind of come up behind me
Mhm.
and to take over.
Mhm.
And I did have opportunities in a few different positions where there was someone there.
Mhm.
And being able to pass that on confidently was something that I feel fortunate to have had that opportunity.
Mm. So a lot of what organizations are craving right now is exactly that mindset that I'm going to turn back. It's kind of like leaving your own legacy and supporting that transition in a way that aligns with your values. And so often we get disgruntled and we just, at the end of it, you're like, I just can't wait to get out. We leave. And then that does a disservice because that transition period is challenged. And I heard you say that you're trying to leave the patients and those behind you off in the best possible way that you can. And back to some of the words that came up that you had
Mm,
mentioned about like resentment or feeling like we are replaceable. Some of the stories is like, for me, I gave my all to the military. They medically discharged me. What that felt like to me was I gave everything. And here you're telling me that no matter what, when I left surgery, I wasn't worth as much to them at that time. So at the time, I interpreted it as like I was willing to give them everything. They weren't willing to do everything for me. That was at the time. I do realize in retrospect, they reciprocated what I truly needed in that moment was someone forcing me to prioritize my own health.
mm,
And when it comes to physicians or those in the healthcare sector, when they feel so devoted and then they get terminated without cause or those things, that stuff happens. And so how do we allow ourselves to align with our values, knowing what you said? And it's sometimes hard to accept that we are replaceable.
hmm hmm Yes, and I work with many clients who, as we work together, they decide that this is not the place for them wherever they are. Um, and many people ask, and I've written articles about this too, is like, do I stay or do I go?
Yeah, that's what
And
I wanted
then
to title this video. It's probably going to get titled that.
do
Yeah.
I stay or do I go? The first thing that I say, and then this kind of goes along hand in hand with, is burnout an institutional, organizational, structural problem, or is it a personal issue? And I think I don't like to compartmentalize these things like one or the other because I
Mhm.
feel like what is it? Burnout is a normal human reaction to an inhuman situation.
Yes.
So it is normal to burn out when you don't have opportunities to take to restore yourself, to refuel yourself, to metabolize the stress and the trauma. So for me, the most accessible aspect, the most accessible alternative of the two is the personal because you're right there. And wherever you
Hmm.
go, there you are.
Hmm.
So let's look at that
Hmm.
first without ignoring the context of the dysfunctional system around you. But what can we do
Yeah.
together to help you
Hmm.
discover who you are, develop those tools, do all of those things? And then as we do that, and you look around you and you have a different mindset shift,
Hmm.
is it still that way? Are things actually now you're aware that you are not a good fit for this place, and
Hmm.
you've been trying to push your square peg into this round hole, and it's just biting you back again, time and time again. And believe me, I know what that feels like. Then we have to start thinking, now what? Where do you feel? If you have the freedom and you've gotten over all of those feelings of, oh, what about my patients? They won't be able to live without me. What about this organization? What about what I have built and brought?
Hmm.
And it's like, great, what a legacy to pass on to someone else. And
Yeah.
how wonderful it is that you've done this such great care for your patients. And now you can allow them the autonomy and the power to move on without you and just all these wonderful things. And now what do you do? And if you can, either you already know a direction you're headed in, or sometimes you don't. I've been in
Hmm.
both places.
Hmm. Hmm. Me
And
too.
and so sometimes you have to leave.
Mhm.
And what do you do? Do you say how terrible this place is and how, people have been mean to you and dysfunctional it is and just let me get the hell out of here? I mean, does that serve you or anyone else? Does it just give them more fuel to say, yeah, oh, there's
Yeah.
another disgruntled person that couldn't hack it, that couldn't make it? Or do you say to them, as I have in other places, that I really feel for me personally that this is not the place for me, that there are things going on with me and how I interact with where this job is taking me that I feel is not a good fit right now.
Mm-hmm.
And so I really feel like I need to move on for my own health and well-being, for my own career discernment and development, and for my family.
Mm-hmm.
And I appreciate everything everyone has tried to do for me and the support that I've been given. And I need to move on. And
Mm-hmm.
I will tell you, getting to that point and saying those words was so anxiety provoking that I would be going in a complete knot.
Mm-hmm.
And I have to say that the vast majority of time, even to people who I said that like gritting my teeth because they were driving me crazy,
Uh-huh.
the response would often be, you have to do what you have to do.
Yep.
And I am glad that you are able to come to this decision. Um, and then several have said, I wish I had the courage to do the same thing.
Absolutely.
And
Absolutely.
that's when I was like,
Yes.
oh gosh, I can relax now. And that
Yes.
feeling afterwards of, wow, not just the relief, but then hope. Then the hope comes. And it's
Mm-hmm.
like, now, if I have the courage to do that, I have the courage to pursue something different that is more consistent with who I am authentically. And I need to keep exploring who I am because I change as time goes on and
Mm-hmm.
as I get older and my body changes. So all of those things.
Yeah, so again, so much wisdom in there. And as a marriage and family therapy intern, what I heard you do in some of the things I regret when I've left positions and was disgruntled, I was able to frame at the end, thank you so much for the opportunity. I'm sorry this isn't a good fit and how my departure might impact you. And I really appreciate XYZ. That when you're feeling disgruntled and you're like, it is hard shift. And some of the communication, whether it's with organizations, close relationships, if we say anything about you, right, it makes us look bad and it puts them in defense posture because we're blaming, right? It's not taking accountability for our part. And so I feel, the circumstance, the I feel about the situation, I need. That helps us to really get attuned to what about it? What do we need? And then be able to articulate it in a way that is less confrontational. And then also going back to helping people discern, should I stay or should I go? And how much of this is personal things. And there are very few times where we might have to push the eject button because it's just so bad of a situation. The health is so poor that we are not able, it's survival mode. We're not able to think. And that, okay, what aspects of myself can I change to make my suffering a little bit less here? And what about the situation, the system's contributing? What you're helping people do is really get clear on what do I need to do? What about the system needs to be true for me to thrive? So that if they do choose to leave, they're running towards something, not running away from something. Because we run away and then we repeat, run away and repeat. It's like, no, all right, I've made these mistakes. I'm speaking from experience, right? All right, okay. And it's like if we're in that moment of pain, we're like, don't tell me that burnout's my own personal problem. It's like there are some personal contributors to how we function that we would like to address so that we can support you in thriving to reduce your burnout risk in the future, knowing that systemic contributions, like you just normalized, high risk for burnout. Also, what I wish I would have normalized rather than pathologized. I think the medical model of mental health does a disservice to many of us in pathologizing depression, anxiety, symptoms of PTSD. I isolated, again, almost took my life because when I was diagnosed with depression, I was like, oh my gosh, I'm worthless, right? It just fed right into that depression narrative. However, if we think about what was true at the time, like I wasn't eating, I wasn't sleeping, I was having an existential crisis, a surgery for me. I had multiple people close to me die, my commander, my ex-boyfriend, ultimately my co-resident. My coping skill was anorexia. That certainly doesn't make you feel great. It makes you have, it's like all those things. And then you judge yourself for not being able to just continue to suck it up and keep going because we think that we're suprahuman. And I know you had said earlier you don't want to speak for everyone. And I'm observing I have a male physician in front of me. So you have the gender, being a physician, the things that might make it harder to get mental health support. Can you speak to your experience on that?
Sure. Yeah, I would say, hmm. So uh, this is a lifelong situation. As I look back again, I saw my own mother um, who suffered from anxiety as I was a young child growing up, and she had chronic medical conditions, which ultimately led to her death at a pretty early age at 63. And that I recognize that even at the time in retrospect, I knew that my behavior around her was was kind of a little bit turned into a reverse caretaker role. And the way that I took care of her was to not get in trouble, not cause
Mm,
issues that would make her anxious, nervous, or depressed. And so I kind of carried that into adulthood, walk on eggshells, be careful, don't get in trouble, don't do all those different things. And so moving forward, it became this sense that the way that I look at anxiety, which anxiety to me is a normal emotional response that human beings have to different degrees. And I think that same physiologic response can lead to excitement, can lead to high performance, can lead to being present in the moment and being on your toes, as it can lead to spinning and catastrophizing and self-doubt and second guessing. And it just depends on our awareness of that, our genetic predisposition, our exposure, our cultural setting, just so many different things.
mhm,
So, by normalizing it, by saying that there are so many factors involved with it, and having tools
mhm,
to deal with it and to realize it, and to realize that if for me it came about with all of this second guessing during medical school, do I belong here? Am I supposed to be here? What does God want from me? What am I, am I not listening? Can I not find it? Am I not good enough? Is all of that
mhm,
stuff, and carrying that into my medical career, my interpersonal relationships, my friendships, my intimate, just everything. And so being aware of those things and being able to understand myself. And it got to the point when I had my first job outside of residency in a private practice that was a horrible fit for me.
mhm,
And I was having all kinds of physical symptoms of back pain and numbness and headaches and just this sense of just had to get out of the office constantly. And then I realized that when I went to a different location and volunteered as a physician in a whole different setting in this inner city clinic with a group of people who embraced me and supported me and would say to me when I showed up sometimes in the evening because I was trying to work my way into health,
uh-huh, uh-huh.
said, Joe, go home. You look exhausted. We'll take care
Yeah.
of things here. And it's like, how can you say that to me? Because I'm here to help you. And,
Mhm,
it's like, no, it's okay. We can tell. Go home.
mhm, mhm,
And so, and I sought out the help that I needed. I had a astute primary care physician. This is when I'm like 28 years old, fresh out of residency. In pediatrics, I just tried to take the quickest way
mhm,
out.
uh-huh.
And he realized that and he said, "Here, I need to refer you to a psychiatrist." At the time, I I don't think I was really aware back then of all the questions that exists in licensing and
Mhm,
applications and hospital privileges and all these other things and faculty appointments about mental health questions. But I do remember talking to a psychiatrist and being diagnosed with general anxiety disorder and being treated with medication and therapy at a young adult age and thinking, oh, is this no, the first thing I thought was, wow, I have to pay all this money for all these
uh-huh.
things that aren't covered by insurance. And
Ugh,
then
yeah.
but it really was another thought down the line of oh, what does this mean to my career? Oh, here are these questions. I remember having to fill out some faculty reapplication or whatever it was, and I brought it to him and I said, there's a question here that says something about my ability to, whether a mental health condition or chemical dependency inhibited or impacted my ability to take care of patients or something like that. It's worded differently everywhere you see it. And he said to me, he said, if you weren't here with me and you weren't going through this treatment that you're going through right now, I would hesitate about how you answered that question. But given the fact that you are getting help and the support that you need, I feel confident that you can be there for your patients and this is not impairing your ability to do that. And that changed my entire mindset.
Mm.
And it was actually the people that are suffering and that do need help and support that aren't getting it that are
Yes.
actually impaired in their ability to take care of
Mm.
patients. And if
Well
you look
said.
at it that way and
Yes.
you say, if I get the help that I need, then that will make me much better prepared to take care of my patients. I think that that's the direction to head in.
That translates to what I'm advocating for the military because I'm much more strong. I am much more capable to be successful in the military now that I've gotten the treatment. Had I not spoke up, just like you said, we self-medicate, we don't develop the tools. It does such a disservice to so many to stigmatize things. And you're absolutely, I am right there beside you, supporting what you just advocated for. Those who are getting the help are the ones who are taking the accountability and are less likely to be problematic when it comes to themselves and also to anything about their performance. And I just think about if we could remove the stigma, how could that impact physician suicide rates? How could that impact military suicide rates?
Yeah,
So,
I agree with you wholeheartedly. And I do know that several medical schools and residency programs now have in-house counselors, coaches,
yeah.
behavioral health providers that do have some mandatory initial sessions and contact with trainees, but to normalize that, and I think fortunately, well, unfortunately, because I believe the stressors and pressures on young people today are greater than they were when I was young. Um, so it's been necessary for them to encounter often the whole world of mental health before I ever did.
Yeah.
So that's the good part is they've been exposed to it. The bad part is that the stressors are greater. But that's the way our lives are these days. So we have to accommodate for that.
Mhm.
And so by coming into the system with an openness to gain support, and as you run into those crotchety old attendings that look like me, that say that, what's the matter with you? Why can't you hack it like the rest of us?
Yes.
Who have lost all of their personal lives and leave a wake of destruction in our pathways. Then you can look at that person and say, I'm sorry you feel that way, but I still need this. And that, I believe, will become the norm of the future.
Wow. That spoke straight to my heart and I think probably my soul. I'm sorry you feel that way, and I need this. As promised, I've kept you way longer than I already knew it. Predictable human. And in thinking about where we are at now, is there any last words or last message you want to make sure to leave with the audience?
I would just say that if you are in healthcare and you are feeling as if you are not living up to your own expectations, that somehow you are failing other people or yourself, you are not alone. You are not abnormal. You are not deficient. You are not inadequate. You're human. And what's good is that you recognize it. And because you recognize it, there are people around you that are there waiting to support you, that have gone through it, that understand it, and that can be there for you in this moment. So just reach out, ask for help, whether it be from therapy, from coaching, from a friend, from anything, anyone. Please do it before it's too late.
Perfect segue into me asking how might they reach out and what type of support do you offer?
Sure. I offer individual one-on-one coaching with health professionals, both from burnout and career discernment to leadership, and also work with medical teams to improve their abilities to recognize their gifts and the gifts of their fellow teammates, as well as how to communicate their needs to each other so that they can support each other mutually, especially when they work within dysfunctional systems in
Mm-hmm.
all those spheres that go out. So everything is information is available on my website, which is joeshermanmd.com. And if you look there, you can see other podcasts I've been on, blogs I've written, and the services that I have available for individual physicians as well as groups. And you can also book a free consultation online there. So that's the easiest way. And my email is joe@joeshermanmd.com. You can just email me directly.
Awesome. Well, I'm going to be having those links in the show notes so that people can have them easily accessible. And I highly recommend getting in touch with Joe. And I super appreciate you hanging on there with me today, going a little bit over our time and sharing your time and your wisdom with us.
Thank you so much for having me, Jillian.
Yeah. And to our audience, please share your questions, your reflections, or any other suggestions that you have in the comments below. We appreciate you being here and we look forward to hearing from you.